Okay, I'm going to repeat Tim saying who the people are. I'm seeing the commissioners who are here. We have Carolyn Obrecht. We have Betsy Beach. Brett Hayes. All right, so those three are commissioners. Let me look at the other people who are here. Tina Elson. Myself, so that's 5. Tim Riker. And hi is Bethany. It's Bethany's phone, HI, it says. Okay, very good. So that's not a commissioner. So, all right, with 5, as far as the quorum, more people should,
Ernest.
but we could go ahead. I think we have a quorum. Yeah, somebody just called me and emailed me that they couldn't get in. So now we're going to be letting them in. They're calling in on the phone. It's Boomy. She's one of the commissioners. She said she couldn't get in. And so I gave her the passcode, and she will be joining the meeting very soon.
She's in.
So now she's here.
Okay.
Okay. So Tim's saying the one that's LG, that's Boomy. That's her phone. When she's calling in, that I don't know if it's possible to rename her. I'm going to see if I can do it as a host. I don't think I have access. Bethany, can you do that? Can you rename her so that it's
Yes.
public? And I just want her actual name so that the commissioners are all visible.
How do we spell that?
Bumi is the first name. Sorry, Bunmi, the interpreter correcting. And the last name is Osho, Osho, if I'm correct. I hope I'm correct.
Yes, that's right.
Good. That's clearer. All right. So now we have 6 people who are commissioners here at the meeting. That meets quorum plus 1. So we can definitely go ahead with the official meeting now. All right. So it's, let's see, I'm just looking. We're officially starting the meeting then at 4:17 p.m. We're 17 minutes late for a 4 o'clock meeting, but that's fine. We'll go ahead now. And I'm going to hold off on public comment for now, just so that we can get the process going. The next item is the executive director's report. Ernest, if you would mind being very like bullet point, just as to reduce the amount of time because we're starting so late, that would be great. Yeah, Bethany, if you could share the screen, that would be appreciated. The agenda for the meeting.
Okay.
Okay. Okay, great. So hello, everyone. The interpreter's ready? Great. I am Ernest Covington. I'm the executive director for the Rhode Island Commission for the Deaf and Hard of Hearing. There's been a lot happening recently, and I will try to summarize. First of all, I wanted to propose for the agenda that we let the VRI bidding service that needs to be approved tonight, and people are asking about the VRI. And I know I've already established an RFP, which is a request for proposals, to have us evaluate. I've been having a difficulty finding people to be on the commission. So 3 or 4 people, we've talked about it to try to figure out what's best. And we have noticed that there are 2 issues. One is if we had like an interpreter agency, and the other is CART reporting. And we don't have VRI services. And with COVID, I've noticed that more interpreters are being requested through VRI. And there's interpreting agencies calling me saying they want VRI interpreters. So I made the decision to start to negotiate. I wanted to, if Bethany could show the amendment or the attachment so the commissioners could see that, what the revisions have been as far as the VRI services.
1 moment, please.
Okay, it's coming up. Great. So this is an amendment. As we've been looking at the policy that we have for interpreting, we realize that we haven't added VRI specifically, and there are agencies that
I'm
are
sorry, this was a comment from way back. I had my hand up quite a while ago.
I'm sorry, didn't see it.
Who's talking? I'm sorry.
I'm sorry.
That's okay, I understand.
I'm sorry.
So the shawl.
hold
and
on,
then
just a moment.
eating And the false milk. It reminds me of a story in another book from Cuba.
Okay. All right. I apologize. I took care of that. Give me 1 moment. There was comment because someone was unmuted and I can't see the participant list when I'm sharing screen. So give me 1 moment.
Okay, very good. So on the agenda, it talks about this amendment for VRS services. And what that means is this is relay services when people are using the phone. And so if people are either speech disabled or hearing disabled, they can use different equipment to make themselves accessible, voice carryover, hearing carryover. And with VRI, I mean, you can have visual access where the communication, the person is making a voice call, but they can see the interpretation or they can see captioning. So with VRI, it's different than the phone. It's video remote interpreting. And with type B, you need to have a licensed interpreter, but I also wanted to add, we could have an interpreter who's VRI, which is a person who's doing facilitation of communication between two people who are on VRS. And I need your approval to the language as it is on the slide, so that we can do a solicitation of a bid and inform people who are running interpreter services who have VRI functionality to bid on this. I've already started to talk about it with the purchasing department, and they've given us the go-ahead because they realize with COVID, so many people are using VRI now, more than ever. And because of that, people socially distancing and whatever, they can't meet in person, they need VRI. So I'd like the commissioner's approval. I know we are having a difficulty, with the agenda, with the time. Maybe people could look at this after and email your comments. And if you all agree, we could call it a vote after the fact, because I have not yet had the type 2 interpreting in the process, and I want to be able to do that as soon as possible so that we can complete it in the next month or so and get that out to people to bid on it. Thank you. Bethany, if you want to go back to the meeting agenda.
Okay. 1 moment, please.
Okay. So the second thing is, there's been a concern about 2021 and 2022 with the budget. With FY 2021, I have not yet received the information from the state. We're still using the 2020 budget. So I've been kind of making do with that. It's been a real struggle because we are not able to get money quickly to get, we're still using the FY 2020. The legislature has not passed the 2021. And here it is coming up on October. So we have July 1st, August, September. We're still using the old budget. So it's been an issue. And unfortunately, FY 2022, it's possible we're going to really get an impact and have a 15% cut. And we had 650,000. I think 21 will be fine, but FY 22, we're going to get this 15% cut. So our budget might be 450,000. It'll be much reduced. And the reason is because of COVID, less revenue from the state, the legislature has said they are not able to collect as much tax. People aren't working as much. They're not staying in hotels and restaurants. So there isn't as much tax generated. And that's going to affect the revenue, and it's going to affect our state budget. So we are going to have a reduction. It's going to be a difficult time. So I want all of you to know that I just got something from FEMA, and they said the expectation is probably that it's going to be like a $15,000 approval for us because of how much we've spent related to COVID preparation. It used to be like 50,000, but they're not giving us 50. They're giving us 15, because we haven't met certain of their requirements. Like you have to order some kits that include PPE, sanitation, masks, those kind of things. And they're saying that they didn't feel like it was a life or death situation. So they gave us feedback on some of these items, and it didn't meet their requirements. We have interpreters, we have video, and the EPCAP, the work that we've been doing where we're sending out vlogs and we're sending out updates and giving the community information about public health. Those things they have approved, but because of that, they're only giving us 15,000. Their policy is extremely strict to meet the requirements. So I just wanted you to know that. The other thing is I wanted to add, for the 5th FTE, we have staff people, and there's 4 FTEs, and then there's 6 on the line. It's going to affect the commission quite a bit with the staff, because the staff, a lot of times we're moving quickly to try to complete certain tasks, and 4 is not enough. If we don't have 6 FTEs, 4 would be overwhelmed. So we really need that. We need to increase to 6. And so we've been asking for an extra FTE. But now with the situation, some of these issues, we may have to hold back and not move forward. And people might be asking, why a 5th FTE? And this is, so we have program support so that we can help, kind of be a floater for some situations, like if Pam or Holly need extra help. For examples, Bethany, the kinds of things she's doing, it's very important to have somebody who's kind of a floater and could help take the load off of other people, because we're noticing that our full-time staff are getting more and more loaded onto them. And right now it's not a good time to do that. So the other point about events for September and October and November. September, we just hosted the virtual job fair this week, the virtual job fair. And I wanted to thank the employment committee for running that. And I also wanted to thank HSTP, which has taken on so much of the one-to-one interviews and the surveys and letting the community know about it. That's been excellent. And the other thing is Pam hosted Deaf Awareness Month, and that's going to be starting soon. We're going to be bringing in more people to focus on BIPOC people, to make sure that there's more equity. We want to know that there's diversity being projected out there, so the community knows that we have that, rather than people complaining, oh, there's no BIPOC people, to show them who we are, so that there's more diversity and visibility of the diversity. So for September, the budget is also due. And in October, I don't know if there's any events coming up, but our goal would be to set up a community meeting where we can discuss with the community. I want to have more meetings, but we've been holding them off for September because September was so full. So in October, we're going to start to have some dialogue with the community. We'll bring in interpreters. We might actually talk about focus groups and try to get input from different groups. The final month, November, on this calendar would be having coffee hours again, but virtual. Obviously, we can't be in person anymore, at least for now. So, we were talking to different individuals who got awards and have been doing speaking engagements. We'd like to involve them more. So we need to talk about that as well. So that's my report, the summarized version as best as I can. So can we switch over to Simon?
Hi.
And Betsy Beach has a question.
Do we need to vote on the first item, which is the?
1 second, Betsy.
Just spotlight it on me.
Right, can you repeat what Betsy said?
Go ahead.
All right, I just want to know if we need to take votes on any of that, such as the first item, the VRI services.
I'm spotlighting you, Tim. It just takes a second. You just got to be patient.
Yeah, because I'm the chairperson. I'm responsible to run this meeting. You know, so please let me recognize the individual before you spotlight them automatically, please. Okay, thank you. I gotta be honest, you know, the communication access is you know, kind of breaking down for this process. I'm not getting the full information. So I don't know if this is gonna continue as is, I may have to stop this and adjourn this meeting. I just feel that it's not an effective meeting at the moment. You know, the spotlighting, you know, it's just not a good fit, you know, for the deaf and hard of hearing community. Okay, so where was I? All right. We already have on the agenda the VRI thing, and we should put that to the bottom of the agenda. Well, I don't think we should address that right now. It's not on the agenda, so let's move it down to new business. Okay, that's first of all. And then what I would like to, as we go through the different items and stuff, then maybe, you know, we can discuss the proposal on the vote and stuff like that. So holding off the vote to the end, you know, just, you know, for the sake of time. Okay. I think the next thing is that we're supposed to have a committee report. So the 4 committee reports is one for the Education Committee. And I'm involved with the Education Committee. However, I was wondering if perhaps, Ernest, is it possible, or maybe I can go ahead and, you know, make the comment on this. No, you go ahead, Tim. Okay. Well, if I remember, I'm trying to recall which meeting it was. I think we already reported that on the last time, right? Yes, we were trying to get we were trying to recruit speakers to come into the house. That's what we were trying to do, to be here for the meetings. Yeah, I'm sorry, Ernest. You're gonna have to repeat yourself because the spotlight just drew us off just now. I didn't catch what you said. Hold on one second, please. This is Ernest. Okay, so Tim, and the comment that you made, you know, about Deaf Inc., you know, you were going to make a proposal about, you know, we're going to call Deaf Inc. from Massachusetts to come into our state to see if we could have a meeting, you know, and to you know, to join our education committee and learn from them.
Okay.
Okay. The education committee, I think you're right. I mean, we have one planned for October. We made an invitation for that, and I believe it's Sharon Applegate, who is the person who runs Deaf Inc. up in Massachusetts. So what I wanted to do is see if it was possible if we can set up some type of meeting here in Rhode Island with her. The last time that we met was way back, I think, in June. It was either June or May. Okay. Now the employment committee. Who can make the report on the employment committee? Ernest. Okay. So would you mind spotlighting Ernest, please? Betsy, and Betsy can, you know, add if she would like to do that as well. To talk about the commission holding a virtual job fair that we did. You know, it's in progress right now, and wow, you know, I hosted a job webinar training. Okay, where I'll be teaching people how to, you know, write the appropriate resume and to try to, you know, network like such using social media such as LinkedIn. And so really, it was really awesome and fascinating. So we took that yesterday, the virtual job fair, which we hosted, and today, and we're also doing one for tomorrow. So I invited some people such as Amazon, Perspectives, various companies and organizations, RIP, NIT, and then we had about 88 companies. We expected about 20 companies, but most of them didn't respond to the invitation, you know, at that time. So Betsy just had her hand up, and I think she might want to add something. She can elaborate a little bit more on that. Go ahead, Betsy. Why don't you just elaborate on that?
Yeah, I'll just say that I'm on that committee, and we were very active over the summer. I think we had 2 or 3 meetings a month in order to get ready for the 2 workshops, the one on resume writing and the one on networking, and then the job fair, which is this week. And I think the other thing to say is we're excited because the employers that did come to the job fair want to return again. They felt they were hosted well and they got their message across well. And I think yesterday I was at the job fair. There were 18 people who signed in and were on the Zoom. So, you know, half of those were employment committee members or the presenters, but half of them were the general public. So I think it was successful, and I think we can expand on it now that we've tried it once.
Okay, Betsy. Thank you for that. Okay, next we have the Healthcare Committee, and also that would include also HSTP, the system, project, HSTP and their crew. Okay, so I don't know if we can do both of them. So Christine West, or is it going to be Brett? Okay, I think, why don't we start with Brett, okay? And then give me a quick summary, and then we'll turn it over to Christine West.
Yeah, sure. If you could get the camera up for me. I think I'm not allowed to turn on. Okay. There we go. Can everyone see me now?
Mm-hmm.
Right. Okay. So I think since the last commissioners meeting we had 2 meetings for the healthcare committee. First one was on August 25th when we introduced Gary Bliss from Project Medical to the committee, and he sat down with us and did a presentation, and it was actually a wonderful presentation. It was very educational, where he talked about accountable entities, meaning like a government agency that provides networking between the providers and for those who are not able to get sufficient health care. They make that connection for them, and they put them in the right places to talk to the right doctors. And we thought it was significant as part of our healthcare committee, because we want to make sure that the entire deaf and hard of hearing community has full access to our healthcare system, including those that may not be fortunate enough to afford their own healthcare. So Gary and his company, they are a wonderful resource to the state of Rhode Island. And as a result of that meeting, after Gary answered a lot of thoughtful questions from the committee itself, we're going to get together with him and talk about how we can make this resource far more accessible for the deaf and hard of hearing community, because we still have a language barrier and a lack of awareness and advocacy from a health care standpoint. And we want to get together and try to see if there are ways we can improve that and make this healthcare access more accessible for our community. And that was the main gist of the August 25th meeting. And then we had another meeting last week, because it was such a good presentation that we ran out of time to go through our normal update. So we had a quick 1-hour meeting last week, and we talked about the update that the HSTP project team is on. And I'm pleased to hear that we have a lot of good things going on at once. Christine and the team are working tremendously hard, and we're really grateful for the time and effort that they're putting into this project. And I know that a few things they talked about was they've had completed several surveys, and We also, if I look at my notes, we submitted our IRB application and we were pending approval for the Institutional Review Board at Gallaudet. And we're waiting to hear back, but that was as of last week. And we just talked about a few other ongoing smaller projects that we have going on. And since Christine is here today, I don't know if there's anything else she would like to add, and I'm happy to turn it off to her.
Okay, go ahead.
Okay, thank you, Brett, for that report. I just want to say, before I share a few more bits of information about the project, I can't say enough about Brett since he's become the chairperson for the Healthcare Committee. He's really taken it to a new level. And so I just want to recognize all of his work with that. We've got more folks who are joining us as a part of the meeting. There's some nice energy that's building around that committee, and we know that before Brett stepped into that role, the committee hadn't met for over a year. And so he's brought some new energy to it and a new commitment to it. And I just want to recognize him for that. In terms of other project updates, Brett is correct. Our main focus right now is getting out our surveys. We have 2 surveys, as you know, as a part of our first goal. One is to healthcare workers, those who are incumbent working within healthcare facilities, and those who are future healthcare workers, those at colleges and universities, nursing programs, physical therapy programs, and so forth. So our healthcare survey is complete, and it was disseminated yesterday to 19,904 individuals across the state of Rhode Island. Quite a large number. And I just want to recognize Lindsay, who's our communications coordinator. I asked her to come up with a distribution list, and the list that she has come up with is phenomenal. And it's something that the commission can retain for years to come. And it literally lists every healthcare professional in the state and different categories of healthcare professionals. So it's quite an amazing list. So 19,904, we've already received about roughly 350 responses in the past day. So we're looking forward to receiving more, and just some great work on that end. And again, I want to recognize Alex LaFerriere for working on that survey, and also Lindsay for the distribution plan. The other survey that goes out to the deaf and hard of hearing community, as you know, we've contracted with Gallaudet. The IRB application is pending, and we should be able to hear, we hope to hear any day now. Once that is approved, we just have some video announcements that we will be making. We'll be contracting with a deaf interpreter for those video announcements, and that will be ready to disseminate to the deaf and hard of hearing community. So we're looking forward to doing that in the next couple of weeks. So we've coined September, Survey September, because that's our big focus this month. Our second goal, workforce training. As you know, we had our virtual spotlight series with deaf and hard of hearing healthcare professionals, doctors and nurses from all over the country. We concluded that series last week. Rick Brooks from EOHHS decided to use some of those
Okay, what acronym? H?
EOHHS.
He sent that out to the healthcare workforce across the state, and that was 700 recipients. But what we're looking to do is also send it out to the 19,904 healthcare workers across the state, so they have access to those videos as well. And I know Thomas Darden, who's also a member of our team, has come up with a training as a part of these learning modules that we're hoping to incorporate in the statewide healthcare portal. So he's done an amazing job with that as well. So that's going to be the next phase. Once we receive the survey results, then we'll go about providing the training, replicable trainings across the state. And those will be recorded on Zoom. And then our final goal is the interpreting program at Rhode Island College. And we did have a meeting this morning at 8 a.m. So we all started bright and early this morning. Great synergistic meeting, great group of people, great discussion. We're all pretty excited, and we're planning a longer retreat during the month of October to really drill down and add more flesh to the programs that we're thinking about. So I just want to conclude by saying I'm so proud of our team that we have and the quality of work that we're putting out there. And I just feel so grateful to be working with 3 amazing individuals as a part of this team who are really putting all they can into this project. And again, I just want to thank Brett for his amazing leadership for the Healthcare Committee. And that concludes my report.
Teamwork makes the dream work.
Okay. Okay, well, thank you for your brief report and the Healthcare Committee and also the HSDP. Okay, so I think now technically, let's talk about Technical Access Communication Relay. Okay, I don't think we marketed for that, did we? And Ernest is saying, no, we haven't. Okay, so we haven't done that yet. Okay, so that's in progress, I hope. I hope we'll be able to get that at the right time when it's ready to go, and then we'll start marketing that and putting out the flyers on that. And then we'll put the committee to work on that one. So right now, I think the 3 committees are moving along pretty good. They're doing great work. I'm happy to see to hear all your reports right now. And next, I think perhaps we should. Well, I think the next thing that's on the agenda, what it says, is that we should have to close the meeting. But I think what I want to do at this time is that we should try to make an effort to finish one, because I invited the speaker. And I finished that. Once we finish with that and we have the discussion, then perhaps maybe we can make a proposal or whatever. And then when that's done, we have just a few little priorities that we need to address, including what Ernest suggested. So let's finish that and then get back to the closing meeting near the end of it. So we'll save those things for the end. So this way we can focus right now on the important part of the meeting that's left, okay? But I want to ask and check in with everybody. Is everybody okay with that if we can proceed in that manner? Okay. Now I know Shane Feldman. I don't know if he's back. Shane, are you back there? Yes. Yes, I am. Okay. There he goes. Hello, Shane. How you doing? All right. So Shane Feldman, had worked with us on contract on the for the invitee assessment. The Rhode Island Commission needs an assessment,
Needs assessment, a needs assessment.
Thank you. And so I know that some people had some questions for Shane, and Shane is here to be happy to answer those questions right now. So why don't we all give a warm welcome to Shane Feldman right now? Okay. I think he has his PDF file. Can we put that up so that we can share his PDF file? Or would you rather just gonna start the meeting first without the PDF file, Shane? I just wanted to make sure that, hello everyone. Good to see all of you. Really, so it's exciting part of the meeting this afternoon. So what I wanted to add, if you wanted to add, yes, it's good to see you too. So what I wanted to ask you about was that I would like to show you right now a PowerPoint that I have, and I wanted to make sure that everybody's ready to see this PowerPoint, because I know there are some people that, they're still on the learning curve for technology. So I don't know if, should I show you to Ernest, or would you rather show it, or do you want me to show it?
Bethany can show a PowerPoint. She can put that up.
Okay, so I'll share my screen with her then? Okay, will do.
And Simon, let's switch off.
Okay.
Thank you. So if you wouldn't mind giving me the host, a co-host so that I can share the screen, that would be great.
Yes, just one moment. Go ahead.
Great. Thank you so much. All right. Okay, so I wanted to make sure that everybody can see the screen, the PowerPoints that I'm showing. If you're, you know, you can change it. There's a line between the side by side so that you can make me larger or you can make the slide smaller. If you haven't had experience with that on Zoom, you can just hover your mouse on the line in between and then move it to the left or the right, however you want to see either me bigger or the slides bigger. So hopefully you've done that. And I want to explain a little bit more about my role in community with the commission and my support, which I think is doing such great work. In the past, last year in the fall through the spring, I was involved with the Commission for the Deaf. And that was when the executive director position was switching over to Ernest, and we were supporting a successful transition to Ernest, and Ernest and Tim have both done great work. The first 90 days, basically. And then I think that things have gone very well. And we had a retreat. It was supposed to be in March, but with COVID hitting, we couldn't do that. We couldn't have a commission retreat to talk about the goals for this coming year. So we spoke about it, and it seems like things were being, it was more reactive than proactive because of the emergency situation. And I wanted to support you all to make sure that you had what you needed now. So we've been in contact and thrown around some ideas as the time has gone on. And with, this proposal, your work has been really essential. And I want to look at this now so we can see where the commission is going from here on in. Basically, we wanted to do a community needs assessment because Rhode Island has had several programs and projects. For example, the Emergency Access Program, Hospital Access Program, several things like that. But Ernest has told me that he wants to make sure that we have data so that we are evidence-based and we can figure out what the community needs and what we need to respond to support the community best and what that would look like. So we have discussed that at great length. And we also realized that there's a great mechanism for collecting data. You had the town hall meetings, you've had surveys, and you shared a lot of that information with me. And I can see a lot of raw data, which is excellent, which really brings us to understand better about what the community needs and how they're reporting their needs. So what services would look like, and also what the state is providing. So we developed some key questions, and I worked with the commission to get a sense of what questions would really get at the issues we're looking at in the community. And this is generally within the state, not just only within the commission. The challenge is that your community has a lot of expectations about the commission. They expect the commission to do many things that we're not really able to do. And we want to know what the commission's role is in relation to that and how we can partner with other organizations to support the community. And on the macro level, not just the staff from the commission. So we collected this kind of information. We built a database. And then we analyzed the Rhode Island community's services that are already existing. You actually have a lot of information. It was helping to organize the information, categorize it before we proceeded to the next step to get a bigger picture. So I worked with the commission and the staff on this project. Then we networked with other states to find out what they're doing and how they collect data for their programs to make sure that they meet their community's needs. We wanted to know what else is happening elsewhere so that we can figure out how to best effectively support the community. Then we brought in the data for what we already had and what was gaps or lacks that maybe other states were supporting and Rhode Island was not supporting for our citizens. And we looked at the commission's information, we looked at what we had collected through the town hall and the surveys, and we looked at a general national picture to get a sense. So that's what I've been doing. And we can close this slide out. basically, that's a summary of what we've been doing to support the commission. A lot involved facilitation, collection information based on the staff and the commission in general to make sure the program met people's goals, and also to support the community. Are there any questions specific about the project or how anything else I can do to best support your needs? And Tim is raising his hand. I'll wait till I'm spotlighted. Tim, yes, great. So, you know, when we talked about possible identifying some benchmarks, things that we already have within the data, for example, you know, whether education or academic achievement, the graduation rate is substantial, healthcare, those kind of things that we already have statistics on, and then apply those to the hard of hearing and deaf community. So if we look at that, we could track from a baseline to the future, but it's difficult to collect some of this data from the deaf and hard of hearing community. In some ways, we've only done things maybe a one-off, and we should do it in the future, maybe every 3 years or some pattern so that we know. But then the issue is also budget reliant. If we don't have the money available, whether we can move forward with like every 3 years. And if we could spotlight Shane. Very good. Yes. Tim, thanks for bringing that up. One of the keys things is to see what is lacking in services, and also to figure out how to measure the success to make sure that the outcomes are something that, you know we've achieved when we do achieve it. So we look at other states, we get a sense of how they measure their objectives. And also when we talk about what the staff have included here in this state, like for example, employment data on deaf and hard of hearing employment. Like the education, like whether diversity is at that particular level. And we've tried to explain that information. We want to explain what we want to measure, and then from there, continue to measure and investigate to make sure that we find the metrics that actually match the different data, the points that we want to find. So if we can figure out, let's say, about healthcare and what achievement looks like within the deaf community, and that would help you because once you establish it, like Tim's talking about, benchmarks. For example, let's say for the year 2020, based on the prior year, then look at, let's say, a result in the Rhode Island Deaf Community Organizations and the Commission partnership over this next period of time. And let's say there was a 50% employment rate and it goes up to 65% employment rate. You can show that there was an effective use of money in supporting the community. And also it would show if there was any decline in services or quality of life, we would be able to get the legislature to award us more money because we would actually have data to prove that. Tim's saying, are there other questions for Shane? Any other questions? Are there any other questions? Sorry, I'll repeat myself because I just got spotlighted. Other commissioners, do you have questions for Shane specifically? If you do have a question, please open your video so that we can see you and recognize you and you'll be able to speak. I'm waiting, I'm just giving people time. If somebody's struggling opening their video, please write in the chat, and Bethany can spotlight you or open your video as the host. If there's anything that you would like to say to Shane. I'm not hearing any. So Shane, do you have anything more that you want to add? And Shane's saying yes, if you could spotlight Shane.
One moment. Here we go.
Yes, some of you might want to be in contact directly with me, and that's fine. You can reach me at Shane at INNIVEE com. And if you want, you could contact Ernest or Tim to get my contact information. Because I would like to get your feedback about what you want to have in the project. And the results of the project will be out probably in the spring of 2021. And best of luck to all of you. And it's been great working with you on this. Okay. So his presentation. So now I'm thinking, if I'm looking at the agenda, we could start with new business. Shane's presentation was on there, Shane Feldman. So the next item we could discuss and then maybe approve the motion that about this needs assessment project. If somebody, I'd entertain a motion if one of the commissioners would like to make a motion or so move to approve the needs assessment project as Shane outlined it. I'm not seeing any response, but if somebody could move to accept it. I don't know if I need people to respond, so I know that you're not. Ah, yes, Brett. I saw you very briefly. Okay. Did you want to say something?
No, sorry. I was trying to see if my video worked.
This is Carolyn
All right, Carolyn.
Obrecht.
If we can spotlight the interpreter, 1 second.
Yes, ma'am. Yes. Just 1 sec.
And the interpreter hasn't interpreted Brett's comment. Let me just get to that. Brett said, I'm sorry, I was trying to test the video.
Okay, so this is
So,
this is
I can't see Carolyn, so I'm not, Tim is saying, so I don't know. But yes, go ahead.
yes, I'm sorry I was not able to open my video, but I managed to unmute myself. So 1 for 2. Okay, here we go. Here, oh, I got it. Whoa, with the help of the host. Anyway, so I would like to recommend that we support the Commission Needs Assessment Program, particularly as presented by Shane Feldman.
Do I hear a second? I'm sorry, I'm waiting to be spotlit. Could I hear a second? Brett, you're seconding. Okay. Brett seconded. So is there any discussion related with specifically with the motion as made by Carolyn?
So I'd like to make a comment.
1 moment, yes. We're just gonna spotlight the interpreter. Go ahead.
I'd like to make a comment.
Yes.
I didn't have a question for Shane because I think this makes so much sense that I think, of course, we have to go ahead with it. Information is power, and so let's get the data and the information.
Betsy, you had your hand up, so we'll wait until we spotlight the interpreter. Betsy Beach. I'm recognizing Betsy.
I know Shane's been working with us for a while, and I'm wondering if the needs assessment has already started. Is it already started happening? I just wonder, and what is the timeline? How long will that process take?
Tim is saying, okay. So I'm being spotlit. Great. Thank you for that question, Betsy. I think the best answer would be from Shane. Maybe you can spotlight Shane if you would want to ask. Yes, if you want me to, I can. Great. So Shane's saying, hi. So the person who asked the question, is that Betsy Beach? Okay. So Betsy, that's a great question. we had decided not to go forward until this meeting to make sure that you all as commissioners like the idea, the concept, and then we would start it. Because I wanted to make sure that I had your support before I started working on the actual project. So it's just an outline at this point. Once I get the support, and of course, I don't know what your decision will be tonight, then I will start working specifically to collect that data. I would say October, and then it would go for quite a few months. And there's the winter holidays. So I'm looking at spring of 2021 for the conclusion. Tim's saying great. So Betsy, does that answer your question? And if there are any other questions?
Yeah, that's what I was wondering. I think it's not the first time. Okay. I was wondering that. I was wondering the timeline. And I think it's not the first time we've talked about this. I think anytime we have talked about doing this, it has been positive, sort of what Carolyn said.
Yes. Tim's saying yes. Okay, so are there any other comments or further discussion? If not, we could move to the vote. Are there any other comments prior to me calling the vote? I'm not hearing any. So let's move forward with the vote. All in favor? If you would please, how to do this if I'm not seeing you all in gallery. I don't know how to vote.
Wait a minute.
Carolyn, you're saying something? Wait,
Did we have a second on that?
the second was the second? And Tim's saying, yes, we did.
Okay.
Yes, Brett. Carolyn made the motion and Brett seconded. And now we finished discussion. So now I'm calling the vote. And I'm wondering if we could do that. Oh, I see on a chat, Betsy wrote on the chat that she voted yes. Okay, great. And if all support the motion, if you look, other people at the chat too, Ernest is saying, I see Tina, other people are typing it. That might be the best way to do it. Just write yes or no, or if you're abstaining. That might be easier than trying to go back and forth between gallery and speaker view. So I see Bunmi, you're on the phone. So I don't know if you are able to vote on a chat, but you can tell us if you're approving it or opposing it or whether you're abstaining.
I say yes. Can you hear me?
Yes, the interpreter can hear you.
Okay,
Okay.
yes.
Yes. So we have Betsy Beach. We have Tina Nelson. And we've got Bunmi. So is there a fourth?
Yes.
And was not able to send the chat, but I say yes.
Okay, so Carolyn is voting yes, and Brett also? And Brett, okay, and me. So, am I missing anyone? Or do I have everybody? There's 6.
Tina also voted yes.
Yes, great. So unanimous, we're all in favor. So the motion passes. Very good. The next step will be Ernest will contact Shane and we'll actually start the project rolling. All right, great. Thank you, Shane, for coming to our meeting and for presenting through Zoom. Okay, very good. And I'll hand it over to Simon.
Okay, so we made the switch over. Now Simon is going to be interpreting. Okay, now next order on the agenda is the new business. But I want to skip down to D, item D, which is related to the FIR that Ernest has spoke about, that he would like to make a change. Now, before we begin to make that motion, does anybody have any questions on this? I see Paul from the public. Okay, Paul from the audience, would you like to say something? Would you prefer to sign for yourself or would you rather speak for yourself? You'd rather sign? Okay. Do you mind spotlighting Paul, please?
Not a problem. One moment.
Hello, everyone. Thank you for allowing me to make my comment. Okay, I just want to make sure that I'm, following the right protocol in the process of your meeting. All right. I have some concerns related to how this is phrased. Okay, and the first one is that if you notice with the insert where it says VIRS, I wanted to know why that was put in there, VIRS. I mean, VRS is already established by the federal government, and they have their process in place with the 4 approvals of the 4 companies. My main concern is if you put VRS into that and insert that into the language, it may cause a lot of confusion for the hearing people out in the public. Because, there might be, from the private sector, from the government sector, they're going to say VRS here, and then they're going to see VRS on the outside with the 4 major competitors. So if it's inserted in that language, I think the role is that VRS, there really is no role there. Okay, VRS basically shouldn't be inserted in there. That's just my, my thoughts on it, but I want to know why you put that in there. And also within the language that you have, VRI, it says under VRI, the way it's explained means that the individual who's deaf or hard of hearing is sitting down with an individual in the same room that's hearing. I'm not sure exactly how they phrase it, verbatim, but it's very similar. But the point is that if 2 people are in the same environment or in the same enclosure of the room, the interpreter is remote at that time. Now, this is what's called, what was the word? I'm sorry, Paul, transitional?
Traditional.
Oh, traditional, the traditional approach to VRI. It's non-traditional, okay? Meaning that 2 and 1 remote, the interpreter remote, it's not. But when you have 3 people that are remote separate in 3 different locations, okay, from point A, point B, and point C, that offers concerns because of the fact that, we don't want to extend or, I just want to elaborate on that because VRI basically really means to the point that the individual, the interpreter has not to be there, okay? But it can be a different combination. It can be 2 in 1 room or 1 and 1 in 1. But the point is that the video interpreter, that's what I'm concerned about, okay? Now, the third item that I want to address in that language is food for thought that I want you to consider, is that we need to be careful. So I, as a company, an owner of a company, I have a concern. But also as an individual, as an interpreter, I have a concern. So I have a concern from both perspectives. In the state of Rhode Island, we have to be very careful because we're talking about licensure that's related to VRI. And the reason why I say that is because I've experienced this already across the United States. Okay, so right now we have about 8 states that are, unlicensing with VRI. If you establish, that can cause, a bottleneck, okay, on the system, if we create that. So VRI is actually, that's using that platform. Now, some states, and I've already, I'm licensed already under Michigan, Arizona, Wisconsin. So I know what the language should be. So the language that's in there, the way it's inserted for the licensure, requires that every licensure, or is it, if they can't provide video interpreters. So I just want to put that out there for you to consider that before you go ahead and proceed with that language as is. I also want to, support, I'm in favor of good quality, that I understand. But if it's going to require everyone, like 10,000 people, and you talk about a long list, you need to keep in consideration how that's going to impact that. So that's my main message with that, okay? Thank you for the opportunity. Thank you, Paul. Okay, would you mind spotlighting Ernest? Ernest would like to make a comment at this time. Okay. Paul, thank you very much, for your comments. Okay. First of all, VRS, I want to clarify a few things. I realize that the reason why I had offered that, because if you feel that needs to be changed, I'm willing to make, changes in there, and then I would like to have that discussion with our legal department too for clarifications. Okay, because I want to make sure that I'm not violating any laws or anything like that. But I am happy, to clarify that article on VRS. Okay, now on the topic of VRI, I understand what your concerns are when we talk about licensure, because I just want to let you know that, when it comes to VRI, the licensing department already recognizes, their 70 or 80 people who are, VRI providers for hospitals, doctors' offices, medical, facilities, and each of them must have a license. That's already there. They have a list of those licenses. Now, the people who want to work, in a VRI setting, in one of those medical settings, that individual, the name of that company has to name and then have to apply for a license. They have to take all that information down. Okay, so right now on that list, we have over 100 that are licensed, okay? That's why people thought that we were trying to get rid of interpreters. We're not trying to eliminate interpreters, okay? But, because when you think about live interpreters, you only got about 20. The rest of it would have to be filled in by VRI. So the attorney says that, if you wanted to have VRI in addition to the interpreters in state, they have to be licensed, okay? So how many interpreters with 20 interpreters? Okay, all 20 interpreters would have to be licensed as well, okay? And so they got a list of all those individuals. Everybody has to be named and licensed. So I just want to clarify that, okay? All right, but thank you for your comment, Paul. I appreciate it. I'd like to recognize Christine West, and then after Christine, we'll see Paul after that. Okay, Christine West, I'm gonna turn it over to you.
If we can spotlight Simon, great. I just wanted to clarify, just for my own understanding, when we talk about VRI, because I'm thinking of two different things in our current environment with COVID. So we have our tier 1 interpreters who are licensed. These are individual freelance practitioners, but they can provide on-site services, but they can also provide remote services. So that's one aspect, but my understanding, and this is where the confusion is, we're talking about tier 2 companies who provide remote interpreting services. And I just wanted to make that distinction. And you're saying that these companies, each of their providers who work under those companies must also be licensed. Am I understanding that correctly? I just wanted to clarify that.
Yes.
Okay. All right. Thank you for that clarification.
Okay. Now, I understand that the Rhode Island Commission is not responsible for licensing. Okay. The licensing board, so I think, in that policy procedure, did you put that in there to mention that the licensing board is the one who's involved in that, not us as the commission? Why did that need to be inserted in there? So if you don't mind, Ernest, would you elaborate on that a little bit? Why you inserted that in the language? Certainly. Okay. The reason why I wanted to insert that, policy in the language was because of the bidding process. Okay. So right now we only have two interpreters, two interpreting agencies and captioning agencies, only two. Okay. Now there are many VRI, companies out there that want to bid for those services, but it doesn't say VRI in the language. Okay. So therefore they can't bid. Okay. So I needed to change that language to include that vernacular of VRI agencies as well, so that they would be in a position that they could bid for services in the state of Rhode Island. Because, we have a real shortage of interpreters here and needs of communication facilities. So some want to use virtual, some want to use, telecommunications. There are many options out there for the people that they want. So we have to put that into language. We have to satisfy what the public wants in the deaf and hard of hearing community. If they don't have availability, then we have to, create that. Okay, to make that, to put that in there, that VRI could also be included in that. So this way that they would be allowed to bid, so that's why I inserted that into the language. Okay, so that the department realizes that they can go ahead and put in for those bids. Once they see that in the language, they'll recognize their bids and they can proceed with the bids. Okay, I see Paul has his hand up again. Okay, because he had his hand up previously. So go ahead, Paul. Thank you for Christine for making that comment. I have the same understanding as well. But the only difference is that, you know, my comment is really related when we talk about tier 1 and 2. Okay, it didn't matter whether it was tier 1 or 2. My understanding now is that the situation is similar, you know, for the Commission for the Deaf and Hard of Hearing. Okay, now Rhode Island Commission for the Deaf and Hard of Hearing, their contract doesn't allow VRI. Okay, because of the fact that the community interpreters have that ability. So it kind of puts them in a dilemma where, you know, where it doesn't matter whether it's tier 1 or tier 2. So now when I was notified, like if they wanted to have a video interpreter instead, then how are we going to facilitate that? That was my understanding. Okay, because that was always an issue. How are we going to address that? It doesn't matter whether it's an individual interpreter, or if it's a freelance interpreter, or a video relay interpreting company, it doesn't matter. But how is the commission going to be handled that when they get that request for an interpreter? Okay, because they can't respond to that. Okay, now I'm working around the, you know, the back end, and you know, with different vernacular and different terminology that they use. So I just wanted to make you aware of that, Ernest. Okay, thank you for that. Christine West, she has her hand up. So I believe Christine would like to add something on that.
Again, just a point of clarification, Paul, are you saying that the provision of remote interpreting services, regardless of tier 1 or tier 2, really there's no current mechanism that exists because that language doesn't exist in the MPA contracts, the state contracts? I just wanted to clarify your last point.
Okay, so a few hands up there. Ernest had his hand up. So go ahead and spotlight Ernest, please. Yes, I want to clarify that. The MPA is for tier 1. Tier 2 has a different kind of thing. They have what's called an RFP. And their goal, you know, is basically with the pay scale, the pay rates, you know, they have something in place. So they have different tiers for those pay scales. Who's the best qualified? They have the cheapest, lower price economically. So they could be independent interpreters where they can be contacted. For example, Christine West, or maybe say a company says that they can't use someone from this, they're not available within the state. We can transfer that to a tier 2 level. Okay, so because based upon their contract and their bid, you know, tier 1 and tier 2, they are different. But once, you know, because tier 1 is obligated under the MPA, but the RFP is under tier 2. So that means that anyone who contacts tier 2, they're going to have to follow that contract. That's how it's outlined in the state of Rhode Island. So you have to find out what the costs are and the fees are according to the contracts that have been awarded by the state. So many of the companies have their own payment rates, and they're not all the same. They're all individual. There's no standardization. So this is why here, you know, we have a tier 2 and an RFP, because we wanted to identify their cost first. Okay, because, you know, the first company that might have good quality, may have, you know, reasonable pricing. Of course, we're going to contact that company first. And if not, then we're going to go down the ranks and find out how we're going to, you know, contact other VRI companies and so forth. So it's a procedure that we follow in place. So Paul, I'm hoping that answers your question.
CW?
Christine, are you satisfied with that response for the clarification?
Yes, I completely understand tier 2, and I understand the private companies, absolutely. Yeah, thank you.
Okay, I don't believe there's any more discussion. Any more discussions on this from the public? Okay, any concerns, you know, with the VRS, and also how the language is inserted in there? Okay, because you have to remember, it's not, you know, this is about the 2 individuals in the same room and so forth between VRI and VRS. I don't know if that will, you know, if that's a solution for that. Does anybody feel that they're ready to go ahead and make a proposal on that to approve it? You know, I mean, of course, with some modification if need be. Anyone want to make a comment at this time? I see a hand up from Tina Nelson. Go ahead, Tina.
Oh, I'll turn off my camera and let Simon interpret for me. I just want to clarify that we're voting on the modifications, the revisions to the original RFP. Those changes are already in place and we're voting on accepting the changes, correct?
I understand. Ernest, so at the meeting, you had the report, and then basically, do you mind showing the screen there? Because that's where it's inserted in the language. Can we look at that? The reason why is because we have to see if there's going to be a modification to the policy, you know, for the Rhode Island Commission for the Deaf and Hard of Hearing, for the inside policy for that, and that procedure.
So you would like,
Does that answer your question? Tina?
And Tina, you're muted still.
I want to clarify that we're voting on the changes that have already been made, correct? Yes. Okay. Thank you. That's what I needed to know.
Okay, thank you for that. So I want to go back and ask, does anybody want to make a proposal to approve with some of the changes or whatever? If somebody wanted to make a proposal for that at this time? Anyone?
This is Tina. I will make a motion that we accept the changes. Sorry. I'm a terrible interpreter being interpreted for. I apologize. I make a motion that we accept the revisions as written for the RFP. Is that what we're looking for?
This is Carolyn Albrecht.
I need to spotlight Tim real quick so he can run the meeting, and he can say who I should spotlight.
Yeah, I just want to make sure who, okay, so in other words, you're speaking about keeping the language as is, right? Ernest, the one that Ernest had presented with no revisions, is that what you were referring to?
This is Tina. Can we spotlight the interpreter?
Spotlight the interpreter. Okay.
Spotlight the interpreter.
Okay.
I may be confused. I thought we were approving the addition of VRI to the RFP. Maybe I'm misunderstanding. Let someone else make the motion.
And we could switch interpreters. I'll turn on my video.
One moment. I'm actually going to spotlight Tim at this point.
Yes. So, Tina, I just want to make sure I'm clear. What your motion is to keep the language about VRS the same, and the language that includes now VRI, that's for interpreters who are remote, but maybe the deaf person and the hearing person are in the same room, if that's correct, the way I signed it. So I just want to clarify your motion, if I could.
Can we spotlight Joan, please?
Yes, ma'am. One moment.
I withdraw my motion and let somebody else take over, please.
Okay. So I'm recognizing Carolyn Obrecht.
Okay, I'm going to
Wait
start
for
off
the
and
interpreter, please.
apologize.
Wait
Oh,
for the
please
interpreter,
spotlight the
please.
interpreter, please. Thank you. Okay, I'm going to start with an apology. I don't feel that I understand well enough what it is that's going to change, because what I want to know is who supervised or monitored VRI previously? And what would this mean for the commission in terms of practical staff oversight?
Thinking, okay, Holly just popped up. So maybe Holly, she does the interpreter referral. Maybe she could make a comment about how this will impact staff. So we can spotlight Joan and Holly can speak.
Thank you. So the addition of VRI to the RFP process is just because in the original RFP, we've asked for bids to get on the MPA as a tier 2 company through the RFQ or RFP, but we've only asked for CART and sign language services. We did not include VRI in that request. And so there are some VRI agencies that have asked to get on the MPA to be able to provide services. But because VRI was not included in the RFP, we couldn't let them apply to be on the MPA as tier 2. So that's why VRI is in there. VRS isn't part of it. That should be edited out because VRS is already set up. But VRI was just an additional service that now, once we can get that opened up through purchasing department to allow agencies to rebid or submit their RFPs again, if they have VRI services, then we can go ahead and include those agencies in what we can list as a tier 2.
Tim's saying, okay, thank you, Holly. That explanation is clear. And Carolyn, I'll call on you. Carolyn Obrecht, you want to make a comment? And Ernest is saying, I have my hand up.
Interpreter. So my question is really to Holly and to the commission. So if you're requesting bids for VRI services, does that mean all VRI requests would come through the commission or you, Holly?
It just means for state agencies. Like if we get, it's usually like if we can't provide an on-site interpreter for a state agency, we would then have the option to pick from a tier 2 VRI agency if the consumer is okay with that option. If we can't provide on-site, then we go to the list of private agencies for on-site, and if private agencies for on-site don't have someone available, then it would go to VRI if that's something the consumer was okay with. So, or if they just want VRI to begin with, because a lot of things are virtual these days, if that's what they want, if the state has a specific VRI agency that they've been working with and they want to be able to provide regular services using this one VRI agency, that they could use that. But it's not like, it's not something that we're not managing extra staff other than making sure that the VRI providers have a license to interpret in Rhode Island. It's just an additional service, like we would have an additional CART agency or remote CART provider. It's just an additional service to add to the process.
I'm going to highlight Tim. One moment.
Hi, yes. So it seems like Christine West had a comment, but I couldn't tell if she was satisfied with the explanation that's already there. And I know, okay, Christine, and then I'll call Carolyn. Sorry, Christine, if you could go ahead.
Thank you, Tim. No, Holly, that was very helpful. That helped to clarify things for me. I think what was a bit confusing was that there's 3 different things that we were kind of talking about. There's the policies and procedures for RICDHH in terms of how they handle requests for tier 1 interpreters providing remote or virtual services, and whether or not there's any process in place for that. And if there's not, would that be added to the policies and procedures? And then those tier 1 interpreters providing remote interpreting services in the same way as they would provide on-site services, so like 2-hour minimums and so forth. So there was that part of it, policies and procedures. And then the second part was actually state contracts. And then the third part was the RFP and adding language. But you helped to clarify that now, so I'm satisfied. Thank you. But I am wondering if there's going to be any policies and procedures that are going to be added to reflect this, both one for tier 1 interpreters and the protocol and the policies regarding accepting virtual assignments. And then also the tier 2 stuff and how that's gonna, what the policies and procedures are related to that.
So yeah, I think that the policies for the policy and procedure manual, we will have to update now that COVID's happened and there are a lot of interpreters providing remote interpreting. So that is something that we should discuss as a office staff as to what additional to put in our manual that we already have. And as for the RFP, we do have guidelines for CART and ASL, but the VRI guidelines would have to be placed in there as well. And I think that's something that we internally have to do as well.
Perfect, thank you.
Great. And I see, oh boy, let's see, Carolyn Obrecht. I see you if you want to
Okay,
make.
one moment, let me spotlight the interpreter. There we go.
So I think this is something I now understand, but I just want to make sure, Holly, it sounds like this is going to help, not hurt your workload. In other words, you're not going to be more overwhelmed. Is that accurate?
Right. It's an additional provider so that when we're stuck with state agencies that have events or meetings and we have no on-site person available, we have a backup resource to say, okay, well, there's no one on-site. Is a consumer comfortable with having a remote interpreter? And that allows us more opportunity to get things covered that would potentially be either postponed or the deaf consumer might be left out of.
Okay. Thank you.
Tim saying, good, okay. So Paul, I think you had another comment and so I'll give you the floor. Paul saying, thank you. I do want to clarify the role of the commissioners versus the office staff related to like what was just talked about with the policy and procedures. And it doesn't really matter if it's tier 1, tier 2, that's not the point right now. We don't have to talk about that. The policy does not exactly say how to coordinate and manage remote virtual video interpreting requests. So who would actually make the decision how that would be developed? For example, I have a concern like if you're considering, like somebody mentioned, if we're following the tier 1 that's currently available and those people are available virtually, then you have a 2-hour minimum, all the other policies. That's been set up, but that has been specifically for on-site, and now virtual may not be the same. And why are we doing that? And then the other thing is that the RFP has the language it says VRI, the word would appear then. And the rates do not have VRI. The word VRI is there, but we don't have rates and policies related to rates. Tim saying thank you. Paul, thank you. If there's, is there anybody who could talk about that a little bit more? If somebody could answer Paul's question. No, okay. So, and
Well,
Ernest, you did have something, or I'm sorry, I'll go with Ernest first. Ernest, yes. He's saying, I think maybe we missed a part of the discussion, or we could hold off on adding the VRI because I think there needs to be some editing and modifying the language first. We have to remove VRS as it was suggested, and then we could make a proposal again, maybe at the next commission meeting. I think we have an October meeting scheduled already. I could bring it up again then, and we could have more clarification. We could have the rationale even put down there so that all the commissioners feel comfortable with the support, because right now there's still some confusion. And I feel like with the amendment, I'd rather fix it first and then maybe check with the legal department, making sure that everything is okay, and then bring it to the next commission meeting for approval in October.
Let me allow Tim
I'm
to be
sorry,
spotlighted.
Tim is saying, did you have a comment about that, Bonnie? I'm going to call on Bonnie Kaplan. All right, so yes. Oh, sorry. I wanted I didn't know I was going to get spotlighted, but yes, I do want to share the information about my experience with VRI. So when I first began working, with TCCA, I was supposed to investigate different rate structures with VRI companies and what kind of interpreting was being provided as well. That's also an important question. So I did come up with a spreadsheet about it. And I prioritized legal interpreter availability, and of course, their price, their cost. And then also, there was another thing, let me think. I can't remember what the second, but exactly what it was. But based on the information I collected, we were able then to pick a company that we felt met our needs. And that has been effective so far. In some situations, we'll find that we need to have communication access for, let's say, a victim. And it may be at a police station, or it might be some legal situation that comes up. And we're able to use our laptop right then and there and make a request for a legal interpreter or a regular interpreter if we need it. It can be automatically, and then they can provide communication access between that victim and whoever it is that they're trying to speak to, whether it's a police officer or an advocate, and that has worked out. So it's really important that you consider what can the company provide on the spot, and most you might have to make a booking in advance. But if you can, I mean, if you have the time and the luxury, great. But a lot of times we need it last minute and some will not provide it. That's something to think about. And the other thing is with VRI, as we're using it now more and more often, I would like to see if they could include certified deaf interpreters, or if those interpreters are willing to work with certified deaf interpreters. For example, let's say I have a meeting and I need a CDI, and I could bring in a CDI live on site where they're with me, with the victim. And then we contact the VRI for the ASL interpreter. The ASL interpreter on the video will be willing to work with the CDI that's on site. Those are questions that need to be, I think, included in your process, because it makes it's going to happen more and more now. And I just wanted to share my experience and give you my 2 cents. Bonnie, thank you. So the policy is more related to the state contracts, I believe, just state agencies. So this would be different, like with the MPA. I mean, your comment, I'm hoping that Ernest, Holly, and the staff can bring that up to put it in mind, keep it in mind as they look at the bids and think about that. But yes, the time is limited as far as how much we can discuss at this point. So hopefully that answers, Ernest has already said we're going to table it for this time and put it on the agenda for the next meeting. And Ernest is saying yes. So yes, so let's move forward with that. Okay. And I think we need to discuss two items of new business. And then it's 5:45. So I don't actually know if we have enough time for the interview during the closed session. And also to discuss the the interviews we did at the last commission meeting. What we've been doing annually with the Rhode Island Commission, we have like events with big coffee hours where people come at the state capitol, the state house. And we have booths from different organizations. And this year with COVID-19, we were still planning something, but I'm thinking now it's going to end up being a virtual remote situation. This year, I'm thinking maybe we could talk about a theme, specifically about racial equity, or connected to BIPOC, Black, Indigenous, People of Color, BIPOC, in the deaf community. I'm wondering if Ernest would want to make a comment about this specifically, and then we'll open it up to the other commissioners. Ernest is saying yes. I'm waiting for the spotlight. Great. Okay. So yes, I wanted to talk about that with Pam because we're going to be hosting a coffee hour and it will be virtual. And we were talking about what the focus would be on: diversity, racism, BIPOC. I agree. We want to think about that specifically. And we'd like a guest speaker who could comment about that person, their own experience, their perspective, their journey, and share it with the general community so that people will benefit from that person, that person's lived experience. So I like the theme. We're talking about like racial equity, or I didn't mean racial equity, equality, and justice, basically. So we could focus on Black Lives Matter, BIPOC, something that's related to that theme. And Tim, you and I are on the same page, and that's what I've been talking about with Pam, how we can get people involved virtually, and we have to consider that too, because it won't be a live event. Thank you, Tim, for bringing it up that way. Okay, so this annual event tends to be the first week of November, and it is already mid-September. So I'm thinking we only have like it's actually less than 6 weeks, less than 2 months for sure. And to work all that out. And also I've noticed in the years past, we've invited people like the governor, the Speaker of the House, the Senate President, people who are involved in Rhode Island politics. And the commission has 2 seats for Representative Handy, and we also have a new one for Senator Gallo. So I'm wondering if the commissioners at this meeting would think about giving some feedback to help the staff plan that event, because everything is remote, everything is virtual. It's so different this year, but I just wanted to put that out. I'm just going to look at the chat because I see somebody. Okay. Yes. If anybody would like to make a comment, if you could open your video. So far, I'm not seeing any. Betsy. Yes, I'm recognizing Betsy Beach. We'll spotlight the interpreter.
Okay. now I'm ready, I think. The great thing about the coffee hour is just learning about the different services, running into people, meeting people. You know, it's a good picture of, you know, who's there in Rhode Island and what's being offered. And I would hate to lose that flavor of the coffee hour. You know, if it becomes just one or two or three people with their stories, it's a totally different event than us gathering as a community and sort of seeing each other. I don't know how to recreate that part of it. I like what Pam did during Heart of Here, during May that month, when she provided short video clips from a lot of people working on these issues. And then we came together to say, you know, a little bit about what, you know, what we had said in the clips and kind of be a group together. So I would like to include something that has sort of a snapshot of our community. I do like the idea of focusing on diversity. It's such a good issue, such an important issue. But I think we can do a little bit of both, a little bit of, you know, kind of connecting as a community and focusing on that issue. That's what I have to say.
Tim saying, very good. So, and Ernest said, I have my hand up as well. And before, I want to clarify, Bethany, did you have something? A concern or what?
The cart provider would like a 5-minute break.
Okay. Wow. Right. Maybe, I think, Ernest, you had a comment about this point. No, I'll withdraw that, Ernest is saying. Yeah, I think people could go and grab some water, go to the bathroom, whatever you need to do. And it's 5:51. If we could come back at 5:57, give you 5 minutes. It's 5:52 now. And I think what we could do is, Bethany, you're able to like pause the meeting, pause the recording?
Yes.
Yeah. Let's do that. It's 5:52. We're pausing it now, and we're going to take a break for 5 minutes and come back at 5:57. Bethany will take care of the technical.
Okay, we're going to proceed now. Okay, so the time is now 5:59, and we are back from a break. And I see we should have all the commissioners back so we can start recording. Okay. So I wanted to go back to the discussion that was related to the Rhode Island Coffee Hour. Are there any more comments or discussions that wanted to take place on that topic? None? Okay. I believe that Betsy's last comment, that she was concerned that she wanted to see more of that networking and the availability of having the exhibitors there because of the booth and stuff like that, and how we can incorporate that in a virtual coffee hour. I believe that Ernest would like to say something. Do you mind spotlighting Ernest at this time, please? Thank you. Yes, Betsy made a comment in terms of how Pam did it, you know, in the past, you know, with the hearing loss month. And a lot of people really responded to that and said that it was great because it showed how, you know, the event actually took place and how to use the coffee hour, you know, and then break. And then afterwards there was socialization, there was networking and stuff. And so I was imagining that if, you know, we're interested in that, then we could use the same type of style of what we did the last time back in May. but you know, something similar, but you know, we can do it for November during a coffee hour. If you feel that this can be done and we can get and proceed with that, I can say, yes, Pam, you know, we want to proceed with that, you know, because we have experienced it already, you know, with that type of approach and we like it, you know, so yes, I mean, you know, going live is really good, but we can also, you know, talk about that, make and see if we can format that style like we did previously and apply it for the coffee hour in November. Okay, we could be focusing on different themes that are related to diversity, you know, and so I would be in contact with Pam to let her know that. And Tim is saying, thank you very much, Ernest. Thank you for your comment. So, the commissioners, do you support that idea that we should go ahead and proceed? Or it doesn't really have to be an official vote at this time, but I'm just trying to get an idea, yay or nay, in terms of how people feel about that to give our, because you know, I want to make sure that we all have our blessings put into that. Okay, so I see Carol Albright said yes. Any other people? Bumby, I know you're on the phone.
Boomy.
How do you feel about that, Bumby?
Bun me.
Boomy.
Boomy, thank you. Okay, I see Tina. Okay, I recognize Tina in the chat, and she said yes. She proceeds. Okay, and then Brett. Okay, and Betsy. Any others?
I'm in agreement.
Okay, Brett's in agreement. Okay. Betsy Beach, I believe she just said yes in the chat. Yes. Okay. Okay, so we can go ahead and proceed. Ernest, yeah, go ahead and continue with your procedure and have a discussion with Pam about this and go forward with that. Okay, well, thank you very much. I appreciate that. Yes, and Ernest just acknowledged that and saying thank you to everyone. Okay. Next, when we talk about the Rhode Island Coffee Hour, you know, typically it's an event that we have every year, and we generally do get, you know, proposals from the people in the community, and then we pick the awards from the proposals and nominations. So we have two that are up on our list right now on two different levels, okay? And it's a recognition award that we issue every year. And the second award that we issue is related to legislative award. Okay, so those are the two awards that we normally give, and those are high honors. And we know that this year, I would still like to get some more applicants, you know, they're being sent in. And typically, you know, around the month of October, we start getting that. We start looking over those recommendations and nominations, those forth. And then we make a vote to pick who's a recipient of those awards. I want to share some information that historically, previously in the past, you know, which was shared with me, there was concerns that the awards were kind of, you know, not, you know, they were of low value, low worth. Because historically, how we award it in the past, most of the people, you know, would be of white privilege. You know, some awards would go to, it just wasn't feel that it was deserving of the people who received it. So they really wanted to raise the standard. So I just want to share that information. It was a concern that was shared with me from the community. So I just wanted to put that out there. Does anybody among us want to, you know, have a discussion about that or question that? I think the importance of that, you know, with the timeline that's left, you know, we want to reach out to the community to say, to start considering about diversity in their, you know, if they feel that there are people that should be recognized for their, you know, activism or whatever activities that they're contributing to, you know, that's my comment. But if anybody else wants to add something to that and have a discussion about that, I'd like to open up the floor for you to say so at this time. Anyone? It's awfully quiet. Okay. I guess we can just go ahead and proceed. Okay, so now that that's finished, you know, it's already 6:05. I know that there's more items on the agenda. So I'm trying to figure out at this time if we want to proceed to close the meeting at this time. We can discuss that, but I'd like to talk about the 5 applications though for the interviews from the previous meeting. Okay, so perhaps maybe the interviews would like to, hold off on that to the next meeting we can.
For the,
You know,
to renew the terms of people who are existing commissioners.
Thank you. For the next meeting, so that this way we can focus. So I'm just kind of curious. I'd like to leave it out to you. So how do you feel about that? Carol Albright, did you want to say something? I see your hand raised. Spotlight the interpreter, please.
You're muted, Carolyn, and I'm spotlighting the interpreter.
Okay. Tim, I don't want to overstep, but rather than discussing candidates, do need to approve the minutes of the last 2 months of meetings, which we haven't done. So can we back up and do that?
Thank you for that reminder, Carolyn. Yes, I overlooked that. Because I was trying to figure out what the technology in the beginning and the spotlighting and stuff. So my mind just, totally overlooked that. Yes, I do want to go back to that. Okay, we can actually go back to this. So did you have an opportunity to review the minutes from the previous 2 meetings that we've had? And if so, was there any recommendations for any revisions or anything like that? Or do you felt that they were good enough to proceed to accept them as written? Carol Albright?
Interpreter?
Oh, so I'm going to spotlight Tim. One moment, because he's still speaking. And if he could repeat what he said.
Thank you. Okay. So what I'd like to do is to get in spotlight Carol Albright with the interpreter. I mean, spotlighting. And Carol, I want to turn it over and recognize you first. And then after we get Caroline Albright, you don't have to come back to me. Just go straight over to Betsy Beach. Okay? Thank you.
Okay. Okay. Go ahead.
Thank you. So yes, I did review both months' meetings, and I feel that I didn't find any need for revision.
All right, spotlight over to Betsy Beach, please. Simon, go ahead, Betsy.
Okay, are you ready, Simon?
Yes, I am.
Okay. I believe there are 3 meetings that we haven't approved, and I'm going to try to find that out right now on my computer and let you know.
Okay, I think Betsy, you basically wanted to, she's gonna look at her list right now on the computer to verify that whether it's 3 monthly meetings or not. Still waiting? Okay, she's reviewing that information at this time. Okay. We'll just give it a few more minutes to wait. You have to excuse me by seeing it on the mic.
Hold on.
Okay, go ahead and spotlight Betsy, the interpreter, and Betsy, you now have the floor.
Yes, I believe we need to finalize from June 17th. August 26th. And is there a May one? I'm not sure about May 20th. If I can find out in a minute, I'll let you know. If I might not be able to find that out.
Can we go back to Tim?
Yes, just one moment.
Yes, on the agenda, it only mentions the month of June and August. In terms of the month of May, I guess you can check that, and then we can follow that with the Secretary of State. And maybe that's still in a draft mode. So maybe at the next meeting, we can get and approve the one for May. Because I know that, historically, when we do the draft, we usually post the draft. But the final, approval usually gets posted again with the finalization. So should we go ahead and, review for the approval for the two that's mentioned in June and August? And then during the next meeting, upcoming meeting, we can discuss the one for the month of May?
Yes.
Betsy? Did someone say something? Spotlight the interpreter, please. Go ahead, Betsy.
Yes, that's fine, because it looks like it will take me a little bit more time to see if I had sent a final copy to Pam or not. I can find that out, but I can't do it that quickly.
Okay. Thank you for your comments. I'm wondering among us, for the minutes that we've read for the month of June and August, is there anyone out there that would like a proposal to make a revision or to accept it as written? I recognize Carol Albright.
Comments, Carolyn Obrecht.
My apologies, Carolyn.
Okay, it's okay. I move that we accept the minutes for the June 17th and August 26th meetings as minutes as written.
This is Tina.
One moment, Tina. I was about to go back to Simon.
Okay. Some of us can't vote on both minutes. I cannot vote on 6/17, but I can vote on the August minutes. So do you want to separate them so that we can vote individually on them?
Tina, thank you for bringing that to my attention. Yes, there's a procedural point, yes. Caroline Albright, would you be willing to do a friendly amendment to our?
Obrecht.
No? Albright?
It's okay. It's okay. My concern is that we don't have a quorum of people who are at that meeting. Is that, can we still vote?
I have to figure out, because I know that the commission, there's been a couple of resignations after that. They've stepped down. So we never did have a quorum. That's why. You're right. Because I believe, if I'm not mistaken, I believe it was Kimmy. She joined and then perhaps maybe, but then she couldn't. I have to figure this out for a second. And then there was Betsy, myself, Brett, Caroline Albright. Obrecht, and then it was someone stepped out, and then we had a replacement. Caroline just asked me about Gina. No, Gina is no longer a commissioner. Claudia is no longer a commissioner. So the only person that's left is Kimberly Marthers. But she probably wasn't there at that meeting. I'm not sure. You know what I think? I think if we go ahead and proceed to the vote with the understanding that if we have 4 votes, the other people that have resigned, we can still have a quorum.
We could basically
I
call
believe-
it abstaining.
Okay, as long as we have the majority that pass. Does that make sense? Okay, Betsy, I'd like to recognize you. Go ahead, Betsy.
Yeah, I just figured it out. I was, I did not send Pam a final draft for May 20th. So I need to have that be approved as well.
Okay, so I want to clarify. So the month of May has not been, it's still in draft mode, right? With the Secretary of State, is that correct? Was it already filed?
That's right. May, June, and August all need to be approved.
Okay. Okay, so can we go ahead and propose to make a proposal, or should we separate that? And separate them into 3 different, because there were different people at these meetings. So do you prefer to vote on the matter for the month of June and then vote separately for the month of August? Carolyn?
Interpreter? So, yes, I move that we separate out the votes for the June and the August meeting. And if I can add to that.
One moment.
Hold on 1 second, please. Get and spotlight the interpreter, please.
Yep. Go ahead.
So we have to vote on that, or can we just vote on the June meeting now?
Yes, I propose that we go ahead and vote on one of those meetings. Doesn't matter. Caroline? Spotlight the interpreter, please.
So I move that those who can vote on the June 17th meeting minutes. And I vote yes.
Anyone else? Anybody second? Brett?
I second that.
Go ahead, I recognize Brett. Okay. So we already have a proposal from Caroline, and then it was second by Brett. Okay, to approve the minutes as is on June 17, 2020 for the minutes. So what I need to do, all in favor of, go ahead and vote at this time. If you need to step out from that one, just let us know, or if you're opposed to the vote, just let us know, whether you are for it or against
If you
it.
need to abstain,
Oh, you sustain. Thank you.
abstain.
So you're going to abstain from that one? Okay. Brett, your vote? What is? Yes? Okay. I see Betsy Beach. Yours?
I vote yes.
Okay, she did it on chat. Okay. And Tina is going to abstain from that. So far we have 3 and 2. Okay, now Bumi, you weren't there, were you? Are you still there, Bumi?
But I don't think you were there in June, he's saying.
Bumi?
At this point, I think it also ask how he was able to go so long, like it's withholding detail.
So we got Betsy, Brett, myself, so it's three of us.
And Carolyn.
Two, three, oh, and Carolyn. Okay, that's four. Caroline is four, okay. So we have four. Okay, so we seem to accept the minutes as written.
All right, and let's switch interpreters. I've got my video open. So he's saying, so Tina and Boomy didn't attend that meeting. Okay, we're switching interpreters. All right.
Go ahead and
Okay,
switch.
so I just want to make sure we've got 4 yes votes. I'm just going to repeat: Carolyn, Brett, me, and Betsy. The 4 of us are saying yes to approve those minutes, and 2 have abstained. And I see Carolyn, I recognize you. Yes, if you could spotlight the interpreter.
Not a problem. One moment.
I apologize for being a pain in the neck, but Brett, you weren't at that meeting.
Uh,
I'm
Did
sorry,
that matter whether I can review the minutes?
but you weren't, you can't, I don't think you can.
Oh, okay, so I can still be supportive, but not,
No.
You can be emotionally supportive, but you can't vote.
well, then I guess we,
Right. So actually, Tim's saying, I'll
Yeah.
wait till the spotlight comes to me. Yes. So Tim's saying, I think we have to hold off because we don't have enough people who are there. The next meeting, I hope we have more people who are actually participating in the June one and we can vote to accept that. But maybe we could go forward with the August. We'll have better luck with August, I hope. Maybe somebody could make a motion. Oh, I think Betsy raised her hand first.
I'll make a motion that we approve the August minutes as written.
Okay, who seconds? Caroline, I see you as a second. Okay, very good. So, wow, she's hot today with the seconds, Caroline. All right, so, oh my gosh, where are we at? How many people are in favor? Please indicate. So I see Caroline, I see Betsy, Brett, Tina. Okay, I'm seeing a message, and me. And I don't know if Boomy was there, if she was already there as a commissioner, and whether she can vote.
Yes. Yes, she was there.
But now she's on the phone, so can she vote? If you could say yes or somehow indicate yes to us.
Yes.
Oh, great. We got that. The interpreter could hear you. Perfect. So that's passed. So we can move forward with posting the final minutes for August. Now, Betsy Beach, you had a comment?
I did just find the email. I emailed you at some point, Tim, that we needed to approve both May and June. So we do have the 2 months. I can resend that email, but I did find it. Yeah, we've been busy and we have not done this step for a few months.
This is Tina. We can't approve May because that wasn't on the agenda.
Oh,
Yes, Tim's saying, sorry. But yes, I didn't put that in. I think Ernest or Pam need to figure out what needed to be approved or whatever. And I didn't have time to go back and figure it out, which ones were. So by the next meeting, we'll have clarified that. We'll have 2, the May and June, that need to be approved. And of course, today's by then will be ready, September. Okay, thank you. I think that's a good time to wrap up. I wish we had more time to talk about candidates, but there were so many things about the meeting, I think, that went overtime. And so I'll put the agenda item on for the next one, like the interview process for the folks who are going to continue their terms, current commissioners, and the closed meeting where we talk about the 5 candidates who had interviews last time. And we need to vote on officers. The people who have already served over a year can run for an officer position. Those have to be tabled to the next meeting, for the October meeting. So I want to thank everyone for coming tonight, and I hope you enjoy the rest of your evening. It's starting to cool off. It's getting a little chillier. Fall is coming. And we are adjourning at 6:26 officially. Thank you so much, everybody. And if you want to come back for the last minute, we could all open up our screens. We'll see you in gallery and we'll be able to say goodbye. Okay. Thank you, everyone.
Thank you, everyone. Have a good night.
Good night. Good night.
Good night.
And Bhumia, if you're talking, yes. Yeah. All right, great. Thank you.
Be with you all.